How are you?
Good. I'm Chisako Sugiyama, student physical therapist. I'm going to be working with you today, okay?
Nice to meet you.
Perfect. I just want to check your date of birth. Can you recite it to me and your name?
Yes, I'm Miriam Reed, and my date of birth is 7/29/1991.
Perfect. All right. So I checked a little bit of your charts to see what was going on. Can you tell me what got you here?
I had a total hip replacement.
Mm-hmm.
I had a lot of pain prior to the surgery, and it got to a point where I just couldn't take it anymore, and I realized it had to be done.
Okay, good. So I was able to check your charts to see how everything went in terms of surgery and a little bit of your prior history as well. But I was just wondering if you could give me a little bit of an overview on, your past medical history, if you've had a surgery before, or anything in that sense.
Okay, I haven't had any surgeries prior to this one. I do have hypertension, and I'm on medication for that. And I have diabetes, so I'm monitoring my blood sugar.
Perfect. Okay, so that's very good. That's good that you definitely know a little bit of what's going on with your medical history in terms of medication, just so you're aware of what meds that you're getting here as well as when you're at home. Are you taking your blood sugar when you're at home?
Yes, I am. I monitor that closely, so far everything's been going really well with that.
Perfect. And then the blood pressure, do you have like a blood pressure cuff that you have at home that you use occasionally?
Yes, we did purchase one, so in case, I don't check it that often, but I do have it. So.
Okay, good. Are you also going to see the doctor pretty often with the diabetes and the hypertension as well?
Yes, I have a good relationship with my doctor, so.
Perfect. Okay. So you had your hip replaced. Do you have any pain right now sitting there from 0 to 10? 10 is meaning you have to get rushed to the emergency room?
Right now I would say it's about a 4.
Okay. And what about at worst?
It probably reaches up to 8, 7 to 8.
Okay. All right. Do you have any pain medication that you were taking prior to surgery that you might have brought here with you?
Prior to surgery, no. I don't have anything with me. I took a lot of just Advil and painkillers over the counter because I didn't have much. I am on painkillers now, but I'm not really sure what they are.
Okay, perfect. So the doctor has you on a painkiller every 4 hours and as needed. So if you feel like you're feeling better, you can definitely talk to your doctor and we can decrease that, so that would be nice.
Okay.
So tell me a little bit about your home life. Do you live in a house, in an apartment? How's the situation with that?
I live in a split-level home, so I live with my husband right now and my dog, and it's just us, so.
Okay, very good. Do you have any stairs at home?
I do. To get into the house, I have 4 stairs, and then going up to the second level, I have probably about 5 stairs.
Okay. Do you have any handrails with that?
Yeah, going in, handrails on both sides, and then going up to the second level, I have just on one side handrail.
Okay, perfect. So when you go up and down the stairs, obviously before surgery, how did it feel? Was it really painful or was it tolerable?
It was very painful going up and down. Towards the end of it, before the surgery, I had to go very slowly, one leg after the other, because I really just couldn't take it anymore.
Okay, sounds good. So we could definitely work, that could be something that we could definitely work on while you're here, so when you do go home, it'll be easier. So along with those stairs, did you use a rolling walker at all at home, or a cane?
I did have a rolling walker,
Okay.
And closer to surgery, probably about a month before, I was using it all the time, because it was just a lot easier with it.
So it seems like you had physical therapy before, is that correct?
Yes, I have.
Okay, good. So you know a little bit of what's going on in the very first session and what's going to be, expected of you and expected of me, so that's pretty good. So besides having diabetes and hypertension, you said that you had no prior history of any kind of surgeries, correct?
Yes.
Okay, perfect. So I wanted to ask you if the doctor reviewed any of the hip precautions with post-surgery with you.
He did go over them, however, there was a lot going on and I was kind of under the weather, so I don't remember everything off the top of my head.
Okay, so I can review them with you. There's 3 things that you should not be doing, especially until the doctor says that you're able to do it. So the first one is bending your hip past 90 degrees. So right now when you're sitting upright like this is 90 degrees. So you want to make sure that you don't lean forward and you don't bring your leg up off the table. Okay, the next one is crossing your legs. You're also not allowed to bend that foot or twist that foot in towards the other foot as well.
Okay.
Okay, so can you repeat that for me?
Sure. So I don't want to go past 90-degree angle, so I don't want to bring myself forward, and I don't want to bring this leg up. I also don't want to cross my legs, which is hard for me because I used to always cross my legs, and I don't want to turn my foot inward.
Perfect. Very good. So do you have any questions so far for me?
So far, so good.
Sounds good. Okay, so you said that you were using a walker. It seems like you had a pretty good understanding of everything when you were at home. So my goals of physical therapy for you is to be able to walk with a rolling walker to begin with, and then hopefully as you start doing outpatient physical therapy, you can walk without a walker. And then if also pain is something that I definitely want to address in terms of comfort, and so we can kind of start weaning you off of that pain medication. Just so for the interactions with other medications, nothing really is bothersome, okay?
Okay.
What are some goals that you have for physical therapy?
I think pain is my number one, decreasing that pain as much as possible. And since I have my dog, I love to walk my dog, and being able to walk him without any walker or any type of assisted device would be my number one goal.
That sounds good. With your dog for right now, do you have someone that's able to take care of the dog while you're still kind of recovering from surgery?
My husband is there, and he's been home a lot working from home since the surgery, so he's always there to help out. And whenever I need, my mom's around. She's right down the road, so she's able to stop in and help us out whenever needed, which is nice.
Okay, sounds good. So now, if I have your permission, I'm just going to take a look at your scar and take a little bit of range of motion measurements as well as your strength, and just try to make sure that your BP is under control, and just check the level sugar levels and make sure everything is okay, and we can go from there. Okay?
All right, sounds good.
All right.